Congressional District Virtual Candidate Forum, co-hosted by The Appeal and Now This. I'm Jay Willis, Senior Contributor at The Appeal, and your host for today. Maryland's 5th District extends from Prince George's County, just northeast of DC, and then south along the west side of the Chesapeake Bay. The incumbent representative is Steny Hoyer, the longest-serving Democratic member of the House. First elected to that position in 1980, he is currently the House Majority Leader, the number 2 Democrat in the chamber behind Speaker Nancy Pelosi. All 5 candidates participating in the Democratic primary were invited to participate today, including Leader Hoyer. And I'm really excited to welcome our guest to this forum. Michaela Wilkes is a formerly incarcerated homelessness activist who is running a grassroots campaign in an effort to unseat Hoyer and represent the district in Congress. Ms. Wilkes, welcome. Thank you so much for joining us.
Hi, thank you for having me.
For sure. First, I'd just like to sort of ask you, tell us a little bit about why you're running for this seat.
I'm running for this seat because for too long in my district and all over the country, regular people's voices has not been heard in the halls of Congress. I'm running because I have witnessed firsthand how broken our political system is, how fixed our criminal justice system is, and how we have a health insurance system and not a healthcare system. Being formerly incarcerated as a child from the ages of 14 to 17, after dealing with the grief of losing my aunt in September 11th, I was incarcerated for truancy. For every 1 day of school that I would miss, I would face 10 days in the juvenile detention facility center. As an adult being incarcerated in 2014, which was a very pivotal moment in my life, being incarcerated because I was impoverished. I couldn't afford to pay traffic tickets, and it suspended my driver's license. And in our district, you need a car to get to work. I had to get to work in order to pay traffic tickets. That same year, I was denied life-saving medications from my health insurance company after suffering a pulmonary embolism, being diagnosed with deep vein thrombosis. And then the medication that I needed for it to cost $30,000 just about for a 30-day supply really opened up my eyes to our political system. And it led me to see that these issues were not individual issues, but they were systemic issues that needed systemic solutions.
That's great. So the COVID-19 pandemic has exposed, or more clearly exposed, many of the ways in which American society, as you alluded to, just is not functioning to protect people from harm. And that's especially true for members of our most vulnerable communities. So in the forum today, we'd like to ask you about steps Congress can take to fill in some of those gaps and strengthen those protections, both during the pandemic and in the long term. But first, I want to ask about your district and this election in particular. Leader Hoyer has routinely fended off primary challengers in the district in the past, over the past several elections even. And I'm wondering, why is this year different? What makes this the right time to challenge him?
This year is different because we are at a pivotal moment in our political system. We're at a pivotal moment in time period, especially during this pandemic. I feel like the sense of urgency has heightened because it has highlighted the disparities across the board in our criminal justice system, in our housing system, in our education system, in our health system, health insurance system. And it's really proving that we need progressive voices in Congress. We just cannot afford to allow politicians that accept so much dark money, so much money from corporations, who are more afraid of their corporate donors than their constituents, to be able to govern us right now. Because that's what we're seeing with this pandemic and the way that they're handling it. It's the reason why Congress isn't handling the pandemic in the sense of the virus and what it's doing to our communities, but instead it's handling the economy. It's bailing out the oil industry. It's not giving essential workers hazardous pay unless under the stipulations that lobbyists are deemed essential. This is what we're going to get if we don't get more people elected like myself that actually care about these issues, take them personally, and that we care more about the constituency than corporations.
So I'm glad you brought up the congressional response in particular, because I want to get into some of those policies and that legislation. So since mid-March, almost 39 million Americans have filed for unemployment benefits. Congresswoman Pramila Jayapal, who also serves as co-chair of the Congressional Progressive Caucus, recently wrote, and I'm quoting, "Mass unemployment is a policy choice. We must choose differently by passing an urgent proposal that matches the scale of this crisis while delivering certainty and direct relief to workers, businesses of all sizes, and the economy." So her proposed solution is called the Paycheck Recovery Act. It would provide grants from the government to fully cover worker wages up to $90,000 and also cover their benefits. Her proposal would be retroactive to March 1st, so it would cover employees who are laid off or furloughed too. And then across the aisle, you're also seeing conservative Republicans like Missouri Senator Josh Hawley gathering support for their own paycheck protection bill and calling Democrats, quote, the party of unemployment. So if you were to represent the 5th District in Congress, would you add your name as a co-sponsor to the Paycheck Recovery Act?
I absolutely would. I think right now our main priority should be protecting our most vulnerable. And our most vulnerable are our essential workers and also small businesses. We should be doing everything we can to help them instead of giving more aid to big corporations as we've been seeing currently.
So the CARES Act, another one of the Congress's relief packages, it provided one-time $1,200 payments, $1,200 checks to most people who are earning less than $99,000 a year. But as the unemployment rate climbs, some members of Congress are saying that, again, one-time $1,200 payments just aren't enough to meet the scale of the suffering we're seeing in this crisis. So there's been another proposed solution to this. Congresswoman Rashida Tlaib introduced the Automatic Boost to Communities Act, and that would provide $2,000 a month, but recurring payments on a regular basis to every person over the age of 16. You've also seen Representatives Ro Khanna and Tim Ryan in the House, and then in the Senate, Senators Cory Booker, Kamala Harris, Sherrod Brown, and Bernie Sanders, among many others, proposed similar plans to provide these recurring $2,000 a month payments. Would you support doing that? And if so, how long do you think those payments should last?
I would support doing it, but I also have my own proposal that I would propose myself, which is I support giving every person $2,500 a month and $500 for each child. But I definitely would be on board with that. And I think that these payments should continue to be dispersed until this pandemic is over, in addition to a lot of other things that we need to be doing in the community.
I want to make sure I understand that. So it'd be $2,500 a month, and then in addition, $500 more for each child in the household?
Yes.
So despite popular support for these programs that we just talked about, guaranteeing paychecks and providing the recurring direct payments, Speaker Pelosi's HEROES Act, which recently passed through the House, includes neither of these provisions. And 14 House Democrats, including both co-chairs of the Congressional Progressive Caucus, Congresswoman Jayapal and Mark Pocan of Wisconsin, voted against the HEROES Act. After the vote, Congresswoman Jayapal said, and I'm quoting again, "At that core, our response from Congress must match the true scale of this devastating crisis. The HEROES Act contains many important provisions, but simply fails to do that." As a member of Congress, how would you have approached this problem as so many people are looking for some kind of relief? Would you have voted for the HEROES Act or against it because of those perceived deficiencies?
I would have fought to expand. I would have fought to expand healthcare, which wasn't involved in the HEROES Act. I mean, it was, but to the sense of fully funding COBRA instead of expanding Medicare to everyone who was laid off, which would virtually cost the government nothing, right? Instead of writing a big check to insurance companies. I would have fought to add monthly payments of $2,500 a month and $500 for each child. And I also would have fought to include rent cancellation along with mortgage cancellation, because what's going to happen is once this is all over, we're going to have a wave of evictions. I would have fought for 75% bonus for essential employees on top of their current salary, not under the stipulation that lobbyists are deemed essential.
If the HEROES Act had come before you as written, though, if you weren't able to get those things in, is it something that you would support as better than nothing, or something that you would vote against because of its failures?
If it were to come to me as it is, I would vote against it. because for me, I'm there to protect those in my community. I'm there to protect the most vulnerable people in our communities. And we have to tackle this problem up to the scale that it is, as you stated before. And simply the HEROES Act fails to do that. It's again giving small businesses, it's again giving regular people breadcrumbs, while at the same time still giving corporations more than the regular working class people.
So when we talk about ways to pay for these programs, polling shows that most people, including most Democrats and most Republicans, would support a policy like a wealth tax on ultramillionaires and billionaires. Usually it's a one-time thing, but there are several different proposals floating out there. Generally speaking, though, what's your position on imposing this kind of wealth tax on very wealthy Americans?
I think that we absolutely need to be taxing the wealth of the 1%, because it is a shame that regular working class people like myself pay more in taxes than people like Jeff Bezos, who is said to, possibly is going to be the world's first trillionaire. I mean, this is someone, and I use him as an example, but it happens really often with these billionaires, right? Jeff Bezos made $11 billion in profit last year. Not only did he have to pay $0 back in taxes, but he got $104 million back in a tax refund, where folks like me have to owe at the end of the year, and I make nowhere near $1 million. $1 million, nevertheless, $1 billion. So we absolutely should be changing the tax code, because the tax burden shouldn't be on regular people. Everyone should pay their fair share of taxes, meaning the wealthy need to pay their fair share of taxes, because our taxes help to pay for these programs. And just think of how much more we can have to put into these programs if people like Jeff Bezos were to pay their taxes.
So politics in Washington also has traditionally focused heavily on deficits and deficit spending. And there have been some proposals on ways to meet this challenge, especially in the face of the COVID-19 pandemic. And one of those would be to support a program that would require the US Treasury to issue $2 trillion, speaking of trillions, of new currency. And this is a theory where some economists argue that it's not actually deficits, but it's inflation that should constrain federal government spending. And one of the programs that has been proposed in this vein is the Mint the Coin proposals, where the US Mint would issue a $2 trillion platinum coin. I'm wondering if you agree or disagree with ideas that the government should look at sort of novel creative programs like this to pay for things like the Paycheck Recovery Act or the recurring monthly payments we talked about earlier.
Yeah, I think that the government should be doing its research into programs like that. But I also think that when we speak about the deficit and we speak about how are we going to pay for these programs, no one says how are we going to pay for, how are we going to pay to enact the war? When Donald Trump enacted his act of war earlier this year, after passing the highest defense budget in history, coughed up another $2 trillion. No one asked where that money came from. And so I think that we need to get out of the habit of asking how are we going to pay for these programs, but instead asking how are we going to pay for it if we don't pay for it? What is going to happen to people? People are going to lose their lives. People are going to lose their housing. And then that's going to make us have to spend more money in order to have to recover from that. It's the same thing with climate change as well. We can't afford not to act on it. We can't afford not to pay for it. And so I think people should start looking at it that way, instead of questioning, how are we going to pay for this? Something else I've noticed is that why do we only ask how are we going to pay for it when it comes to helping regular people? That's the only time we hear people saying, how are we going to pay for this? We need to be focused on helping regular people, just like we don't ask, how are we going to pay for $2 trillion in weapons after passing the highest defense budget in history? Nobody blinked an eye. I think we should do the same for regular working class people.
Yeah, sometimes it feels like the harder the problem, the more hand-wringing there is over how to pay for it.
Yes.
Switching gears a little bit, Senator Elizabeth Warren and Congresswoman Alexandria Ocasio-Cortez recently introduced another piece of COVID-19 related legislation, the Pandemic Anti-Monopoly Act. And as this bailout money goes out, this act would temporarily ban merger activities for certain large companies, including investment firms, many financial institutions. Summarizing her argument in favor of the legislation, Senator Warren said, as we fight to save livelihoods and lives during this pandemic, giant corporations and private equity vultures are just waiting for a chance to gobble up struggling small businesses and increase their power through predatory mergers. So would you support a temporary merger ban?
I absolutely would support that. I mean, it comes again protecting our most vulnerable at this time. We absolutely should not be allowing the big corporations to prey on small businesses. We should be helping these small businesses to protect them from instances like this, protect them from practices like this where they can be taken advantage of. And so I would definitely support that, especially in our district. We have so many mom and pop businesses, so many small businesses here. And so we need to do whatever we can to do to protect them.
Again, switching gears a bit, the United States, as you are probably aware, has the highest incarceration rate in the world. And there's all sorts of statistics that illustrate how grim this is. This country is home to 5% of its population, of the world's population, excuse me, but a quarter of the world's incarcerated population. And at the federal level, one recent bill to address this problem looks at excessive sentences. It's a bill proposed by Senator Cory Booker and Congresswoman Karen Bass. The Second Look Act would allow federal judges, in the interest of justice, to reconsider and modify prison sentences that were longer than 10 years if the person has served at least 10 years, is not considered a quote unquote threat to any person or community, and is deemed ready for reentry. And I'm curious on your position, both as a congressional candidate and, as we talked about, as a formerly incarcerated person. As a member of Congress, would you support this act?
That's something I would be on the fence about, because what are the guidelines for if someone is no longer considered a threat and ready for reentry into the world? I think what we need to do is take it a step further and get rid of mandatory minimums. It's something that we need to do. And if we look at other parts of the world where we have some places where they have a maximum sentence of like 20 years, but you reform the way that you have your criminal justice system and you focus on rehabilitation. But I mean, you just can't simply put someone in front of a judge after being in a jail, in a cage, being treated inhumane for years. You know, these people that are incarcerated, there are some, for the most part, treated as less than human. And then you want them to go in front of a judge and have them to say if they're ready for reentry when they have already had to conform to a certain way of living to survive. We have to change the way our jail system works and make it focused on rehabilitation and treat people that are incarcerated like humans. I don't see that working out, especially for people of color, especially for Black people. I don't see it working out for them. I just don't. So I would definitely be on the fence about that. I would have to add my own pieces to that legislation in order for me to just sign on to that, because you have to think about the negative effects of passing something as well.
Right. So, and recognizing that in this political climate, change in this area, mass incarceration reform will probably proceed on a piecemeal basis. If the legislation, at a high level that I just outlined were to come before you, without you being able to add some of the more progressive changes that we've talked about, is that something that you would support, or is it something that you'd withhold your support from to make clear that you don't view it as sufficient?
I would withhold my support from to make clear that I don't view it as sufficient.
Congresswoman Ayanna Pressley of Massachusetts, she recently introduced a resolution, the People's Justice Guarantee. It includes a plan for creating first responder agencies to respond to problems that arise from substance use disorders and mental health diagnoses, and just problems that are caused by poverty, things that we have police addressing now, but don't really need to be addressed by police, especially armed officers. So this would include, for example, the designation of a non-911 number for dispatch of crisis and trauma intervention teams. Would you support the provision of federal funding, significant federal funding, to support local programs like this one?
I absolutely would, and I think programs like that will save lives.
You talked a little bit about healthcare earlier, and especially how Congress's responses to the pandemic have largely left healthcare out, which seems like a counterintuitive way of addressing a problem that is putting folks in the hospital and affecting their lives in that way. Senator Bernie Sanders has introduced a bill, the Healthcare Emergency Guarantee Act, that would empower Medicare to cover all healthcare costs for people who are uninsured, as well as out-of-pocket expenses for people who do have insurance, including prescription drugs. until a COVID-19 vaccine is available. Now, there's polling conducted by Data for Progress and the Justice Collaborative Institute that shows that more than 2 in 3 Americans, that's members of both parties, support this kind of a crisis care plan. After all the arguments over Medicare for All, it seems like the pandemic is causing people to reevaluate their perspectives a bit. As a member of Congress, would you support a crisis care plan in which the federal government takes responsibility for healthcare costs for the duration of this crisis?
Yes, I absolutely should. Going back to protecting our most vulnerable, and also going back to healthcare being a human right. And we should absolutely be given healthcare regardless of our ability to pay for it, especially at a time where millions are losing their jobs and losing their health insurance that is tied to their jobs. We should be able to do that. We should be able to protect folks and make sure that they have the healthcare that they need until we come out with the vaccine. Because the fact of the matter is treatment for COVID can go up to $75,000. And so you have folks that are even afraid to go get tested. They're even afraid to go into the hospital because their first thought is, well, how am I going to pay for it? And so these are the issues that we're dealing with, that we're facing. And as we said before, we need legislation that is going to handle it up to the scale of as which things are happening right now. And so absolutely putting the cost on the government to be responsible for people's health care until we receive a vaccine is 100% the way that we need to go. And I would gladly vote for
that. Senator Gillibrand of New York has introduced a bill sort of in the same vein to guarantee paid sick leave to Americans. In an op-ed for Time, she pointed out, as has been raised many times before, the US is the only industrialized country in the world that doesn't guarantee workers some form of paid leave. According to the National Partnership for Women and Families, just 19% of US workers have access to paid leave via their employers. And due to this lack of paid sick leave, low-income workers, they basically face this impossible choice, right? As governors reopen states amid so much uncertainty. So workers can either follow CDC guidance, stay home, be safe, and risk not being able to feed their families, or put their health on the line in order to put food on the table. Would you support a program for universal paid sick leave? And talk to me a little bit about the details of it, because there's so many different forms that could take, right?
Yeah.
What details would you include in a sick leave plan?
So in a sick leave plan, I would make sure that everyone is covered by it. And I would make sure that it doesn't cut into PTO, because right now there are 2 kinds of leaves that you can have, right? Or the basic 2 kinds of leave that you can have, which are the PTO and the sick leave. Like for my job and for most jobs, you only get PTO, but it doesn't count for sick leave. And so people are having to use vacation time, to say, oh, well, I'm sick, which shouldn't be the case. Folks should be allowed to have mandatory sick leave, especially in a climate like this. I think it's really showing that we absolutely need mandatory PTO in addition to sick leave, so that folks can be able to take care of themselves at a time like this. And we see in the beginning where folks were so concerned with, oh my goodness, if I become sick, I can't take off of work. If you have to quarantine, you don't have any leave to quarantine. And so it puts you in those kinds of situations. And so I think that people should get at least 3 to 4 weeks of sick leave a year, especially during this climate where the virus takes a while to work itself through your system. You should be able to have as much time as possible as you need to get over that. And I think that it should go beyond the pandemic. I think that we should be guaranteed sick leave in the long future to come from this. I mean, it's really unconscionable that we don't. Folks go to work every single day. Folks go to work even when they're sick to make a living, but it's like when you get sick, you can't take time off. And it also helps the businesses out to not be able to not contribute to spreading the virus from people having to go to work because they're sick and they don't have sick leave. So.
Tell me a little bit about your work with the homeless community. I know ending homelessness has been a major issue for your campaign and a reason why you're running. What policies would you look to implement at the federal level? Of course, realizing that homelessness is primarily, the primary providers are state and local governments. But what would you look to do at the federal level? And just more generally, how has your work with that community influenced your run for Congress here?
Yeah, so I have a lot of close friends who are homeless, which has led me to become more active in the homeless community with going out and making sure they have food, sometimes even housing them or letting them come to my house to take a shower, going out, providing them hot meals, providing resources for them, whether it's blankets, clothes, jackets, taking them to homeless shelters if they need be, but just being someone that they can count on and someone that they can trust. I can go in any of the communities and people are so, happy to see me. These are my friends. And so it's not like I'm fighting for them, but I'm fighting with them. But it's really led me to see that you don't have to be jobless to be homeless. You don't have to be, what the stigma is to be homeless. I have friends who work and are homeless. I have a friend who's been homeless for going on 12 years now because they get disability and they're forced to live in poverty because, should they decide to go get a job to supplement their income, it disqualifies them from certain government programs. And she gets like $700 a month. And speak of the stimulus check of $1,200 in our district. Good luck finding an apartment, a 1-bedroom apartment for $1,200. Nevertheless, $700. And so it's really led me to champion affordable housing policy. And it's really led me to one of the things that I want to enact as soon as I'm elected is to fully fund the Section 8 program, which would only cost the federal government $40 billion. I know for us, it's not only $40 billion, but for the government, it's definitely only $40 billion. But it would end homelessness because the fact is that right now, 1 out of 4 people are actually getting the Section 8 housing assistance that they need. And it's leading to longer wait times. And that leaves 75% of people without the housing assistance that they need. And the issue is because the program is significantly underfunded. And so if we can just chip in that $40 billion, fully fund the Section 8 program, allow folks to get the housing that they need, put them in units, in addition to enacting a homes guarantee where we give local counties and municipalities federal funds to build affordable housing units throughout the country, 12 million. Along with giving those counties and municipalities federal incentives to lift zoning restrictions so that we can build these units within our community. These are things that would essentially end homelessness in our communities, and it would not cost the government much to do so. We have more vacant homes than we do homeless people in our country. So we can absolutely afford them. And if money is the problem, then the government needs to pay for it.
Needs to be minting that coin, right?
Yes.
In your district specifically, how have you seen the COVID-19 pandemic affect the homeless community and exacerbate some of these issues you've been talking about?
I mean, our homeless communities are suffering a lot. They don't have the resources that they need to sanitize. They don't have the resources that they need to social distance, right? We have tent communities out here. And so it's really taking a toll on folks. And I'm really surprised that in either of the stimulus packages from the government, I don't believe I saw anything in there about emergency shelters or placing people in units or, placing folks that are out on the street somewhere where they can have the resources that they need. And so it's really why we have to focus on, again, protecting our most vulnerable. And in our district, so many people where I live, almost every single business is an essential business. Because in my district, we don't have like a whole bunch of government buildings. You have to go to like Washington, D.C. or Northern Virginia. Like in our district, we have grocery stores, we have mom and pop businesses. And so it's affecting folks because for one of what we talked about, not having sick leave, having to go to work because you're sick, and also the one-time mean test at $1,200 payment isn't helping folks. We can't pay our rent. If we don't have enough money to do so. So people are forced to go to work even when they're sick. And then we see the unemployment problem that's going on in our district. Not just in our district, but the state of Maryland. The Department of Labor is like broken right now. I mean, so many people haven't even received an unemployment payment in weeks. And they're talking about going forward with evictions later on in June, I believe, when folks still haven't even received an unemployment check. I mean, these are the things that are going on not only in our district, but in the entire state of Maryland.
The last thing I want to ask you about, and obviously it's been a major point of contention during the Democratic presidential debates, and I'm sure it's on your mind and all the Democratic congressional candidates. Going forward, there's certainly appetite in this country for more healthcare reform, but there's a lot of different proposals floating about what it would be. Now, I know Leader Hoyer has sort of expressed reluctance or skepticism in the past about a single payer program. How would your approach to a program like Medicare for All differ, if at all, from his?
It would differ 100% because I actually support Medicare for All and he doesn't. And I would say it's that way because I am not beholden to any insurance companies. And I think that we need to be bold when we tackle the issue of people getting healthcare. Steny Hoyer is in favor of keeping the status quo. He's in favor of maintaining the current system that we have, which, as we can see again during this pandemic, is inefficient. It's not working. The current system that we have is not working. So why keep stressing we need to protect the Affordable Care Act? Okay, yes, we do need to protect it in the meantime until we get Medicare for All. We need to have a healthcare system where we don't have out-of-pocket costs, because right now, folks, we are paying for Medicare for All. We're paying for Medicare in addition to our own private insurance, and we are still being denied healthcare. And I think in this climate, it shows that we don't need health insurance that is tied to your employer, because when you lose your job, you lose your health insurance. And even when you do have health insurance, most of us are underinsured. So many of us pay so much in premiums and are still able to be denied healthcare. I'm in favor of a universal healthcare system, period. Not access to healthcare. We already have access to healthcare, but the issue is that it's not affordable. I have access to a Mercedes Benz, but can I buy one? No. I mean, and that's what it comes down to.
That's about all I've got for you today, Ms. Wilkes. And thank you again so much for joining us, for talking through some of these issues. We really appreciate your time.
Thank you so much for having me.